Have you ever experienced that nagging knee pain when climbing stairs? Or that stiff lower back when getting out of bed in the morning? Many people dismiss these symptoms as normal aging. But what if I told you these could be warning signs of something much more serious happening inside your bones right now? According to the World Health Organization, 1 in 3 women and 1 in 5 men over 50 will experience an osteoporotic fracture in their lifetime. Even more shocking, 20% of elderly patients who suffer hip fractures die within 1 year. These aren't just statistics. These are real people whose lives were forever changed by weak bones. I became deeply interested in this topic when my own family member was diagnosed with osteoporosis. That's when I discovered the most remarkable research study I've ever encountered. Scientists followed 160 people for 10 full years, using advanced CT scans every 3 months to track exactly what happened to their bones. The results were so extraordinary that they challenged everything we thought we knew about aging and bone health. Most people believe that taking calcium supplements and vitamin D is enough to protect their bones. While these nutrients are important, the real game changer was something completely different. Something that not only stopped bone loss but actually reversed it. The secret weapon was strength training. But not just any kind of strength training. This was a specific protocol that produced results so dramatic they seemed almost impossible. Harvard Medical School published these findings in 2023, and the numbers are staggering. After 10 years, the group that did strength training had 28% higher bone density compared to those who didn't exercise. But here's what blew my mind. While most people lose 1 to 2% of bone density every year as they age, the strength training group actually gained bone density. At age 65, their bones were stronger than they were at 55. The study divided participants into 3 groups. The control group did no strength training. The second group did light resistance training twice a week, and the third group performed high-intensity strength training 3 times a week. All participants started with similar bone density levels and were followed with precise CT scans that could detect the smallest changes in bone structure. After 10 years, the results were breathtaking. The control group lost bone density at the expected rate of 1.8% per year, totaling an 18% decrease over the decade. The light exercise group slowed their bone loss to just 0.5% annually. But the high-intensity strength training group experienced something remarkable. Their bone density increased by 12% over 10 years. Their spine density improved by 15%, and their hip bone density increased by 18%. When researchers compared the CT scan images side by side, the difference was striking. The bones of those who didn't exercise became visibly thinner and more porous, while the strength training group developed denser, thicker bones that looked like those of people decades younger. It was as if they had reversed the aging process in their skeleton. But how does this actually work? Your bones are living tissue that constantly breaks down and rebuilds itself in a process called bone remodeling. When you perform strength training, your muscles pull on your bones with tremendous force. This mechanical stress signals your bone cells to create stronger, denser bone structure. To handle the load, Johns Hopkins University researchers discovered that the mechanical stress from strength training increases bone-building cell activity by up to 380%. These cells, called osteoblasts, work overtime to create new bone tissue wherever stress is applied. Even more fascinating, the benefits aren't limited to the bones. You're directly exercising. Compound movements like squats and deadlifts trigger the release of growth hormone and IGF-1, which promote bone formation throughout your entire body. The most effective exercises in the study were compound movements that worked multiple muscle groups simultaneously. Squats, deadlifts, bench press, overhead press, and rowing exercises form the core of the program. These exercises create multi-directional stress on bones, maximizing the bone-building response. The intensity was crucial. Participants lifted weights at 70 to 85% of their one representative maximum, performing 6 to 10 repetitions for 3 to 4 sets. This intensity was heavy enough to stimulate bone growth, while remaining safe for the participants. The frequency was 3 times per week, allowing adequate recovery between sessions. Remarkably, bone density improvements were measurable after just 6 months, though the most dramatic changes occurred after 2 years of consistent training. However, the key factor was persistence. Participants who stopped training after 3 years began to lose their gains, while those who continued for the full decade saw progressively better results. Beyond bone density, the study revealed incredible additional benefits. Participants increased their muscle strength by an average of 45%, and boosted their metabolism by 12%. Their blood sugar control improved dramatically, with hemoglobin A1C levels dropping by 0.7 points on average. While most people lose 1% of muscle mass annually after age 40, the strength training group actually gained 8% more muscle over the decade. Balance and coordination improved so much that 65-year-old participants maintained the balance abilities of 45-year-olds. This translated to an 82% reduction in fall risk. Compared to the control group, mental health benefits were equally impressive, with depression scores decreasing by 34% and quality of life measures showing significant improvement. Perhaps most importantly, the medical costs for the strength training group were 43% lower than the control group over the 10-year period. Emergency room visits and hospitalizations, particularly for fractures, were dramatically reduced. Many participants reported feeling stronger and more energetic at 65 than they had at 55. So how can you start experiencing these benefits? The key is progressive overload and consistency. Begin with a thorough assessment of your current fitness level. Simple tests like how many push-ups you can do, or how many times you can stand up from a chair in 30 seconds will help determine your starting point. Start with bodyweight exercises for the first month to learn proper movement patterns. Gradually add resistance using dumbbells, resistance bands, or barbells. The 5 core exercises that proved most effective are squats for lower body and spine, deadlifts for posterior chain and hip bones, bench press or push-ups for upper body, overhead press for spine and shoulders, and rowing movements for back strength and spine stability. Focus on proper form before adding weight. Each exercise should be performed with controlled movement, taking 2 seconds to lower the weight and 1 second to lift it. Breathe out during the lifting phase and breathe in during the lowering phase. This breathing pattern helps stabilize your core and maximize the bone-building stimulus. Your workout schedule should include 3 sessions per week, alternating between upper body focus, lower body focus, and full body sessions. This allows adequate recovery while maintaining consistent stimulus for bone growth. Rest periods between sets should be 2 to 3 minutes to allow for full recovery. Nutrition plays a crucial supporting role. Protein intake should be 1.2 to 1.6 grams per kilogram of body weight daily to support muscle and bone protein synthesis. Calcium needs remain at 1,000 milligrams daily, but it's more effectively absorbed when combined with resistance training. Vitamin D levels should be maintained between 800 to 1,000 IU daily. And don't forget about magnesium and vitamin K2, which are essential for proper calcium utilization. Sleep is when most bone remodeling occurs, with 80% of growth hormone released during the first 2 hours after falling asleep. Aim for 7 to 8 hours of quality sleep nightly to maximize your bone-building potential. However, safety must come first. If you have existing joint problems, osteoporosis, cardiovascular disease, or diabetes, consult with your physician before starting any strength training program. High-intensity exercise can temporarily increase blood pressure and blood sugar fluctuations, so medical clearance is essential for those with health conditions. Start conservatively and progress gradually. Joint pain that persists beyond normal muscle fatigue is a warning sign to reduce intensity or seek professional guidance. Remember that appropriate muscle fatigue is normal and expected, but sharp joint pain is not. Individual responses vary significantly based on genetics, baseline fitness, nutrition status, and hormonal factors. Don't compare your progress to others. Focus on consistent improvement over time, rather than dramatic short-term changes. If this information has inspired you to take action, please like this video and subscribe for more evidence-based health content. Share this with family and friends who need to hear this message. Together, we can build a future where strong bones and active aging are the norm, not the exception. Thank you for watching, and here's to your strongest, healthiest years ahead.